We'll start by going through the bony points of the shoulder. So we'll start with the scapula to begin with. So we can start on the medial border on the skeleton here. So you can see the medial border of the scapula. The medial border runs down to the inferior angle of the scapula, which is quite easy to palpate on a person, and we'll show you that later. So the inferior angle then goes up to the lateral border, which is running up here. The lateral border is quite difficult to palpate due to quite a lot of muscle bulk running across, so the teres major and minor. If we come back up from the medial border, you've got your superior angle, which is there on the scapula. You then can see this bony prominence here, and this is the spine of the scapula. And the spine of the scapula runs round to form a bony ledge, which is the acromion process there. If you keep following it round, you come to the clavicle. So this is the clavicle here, which is on the anterior aspect. You've got two main joints which sort of work with the clavicle. So you've got your sternoclavicular joint, which is where the sternum meets the clavicle, and your acromioclavicular joint, which is where your acromion meets the clavicle. If you look at the anterior aspect of the spine of the scapula, you have sort of a bony prominence here, and that's your coracoid process. If you drop off the acromion process onto the humeral head, you can see here you've got a groove, and that's your intertubercle groove. If you move your hand this way, you have the greater tuberosity, and on the more medial aspect, it's the lesser tuberosity. Okay, so moving back now, I'm just going to talk about some of the fossas. So here you have the infraspinous fossa, which is basically the attachment site for the infraspinatus muscle. You also, sort of above here, have the supraspinous fossa, and that's where the supraspinatus muscle lies, and that causes quite a lot of tendinopathies due to it getting impinged on the acromion process. You also, on the anterior aspect of the scapula, have the subscapular fossa, and that's where the subscapular muscle sits. Cool. Okay, so now we're going to palpate it on a human. So what you do to begin with is locate the medial border. So if it's quite difficult to see initially, you can get the patient to put the hand behind the back, and it does become quite prominent then. So this is the medial border of the scapula here. If you use your thumb to sort of palpate along its edge. You then come to the inferior angle, which is here. So you just thumb and first finger, you can sort of sit in there. You can then move along to the lateral border. You have to sink in quite deep to feel the lateral border, and you can't really feel up very far due to sort of the muscle bulk running across there. So if you come back along the medial border, you should feel the spine of the scapula. So to palpate the spine of the scapula, use your two fingers and sort of run along either side there. And follow it round until it sort of comes onto an anterior aspect, and you sort of come onto a bony ledge, and that is your acromion process there. So then if you sort of drop off the acromion process, you should come to the clavicle. So with the clavicle, again, just follow it along its edge here until it stops. So this joint here is your sternoclavicular joint, which is where your sternum meets your clavicle. And if you follow it back along, where the clavicle meets your acromion is your acromioclavicular joint. If you drop off the clavicle, you should be able to feel a bony prominence around about here, which is your coracoid process, and that's a bony prominence on the anterior aspect of the scapula. Okay, so then if you just drop your finger off the acromion process, you'll slip onto sort of the greater tuberosity. So what you want to get the person to do is to laterally rotate. As you laterally rotate, you should feel your finger sort of slip into a groove, and that's your intertubercle groove. And if you keep laterally rotating, your fingers should sort of push up onto a mound again, and that's your lesser tubercle. So your lesser tubercle's here, intertubercle and greater tuberosity.